Beyond GLP-1s and weight loss, what do you think is the opportunities that you see for platforms like Tuyo to help sort of streamline the patient experience and just the workflow around getting someone through the perioperative period?
My office has worked hard for years to streamline the process for patients, and it's gotten more complicated as plastic surgery has evolved into this realm where I service many patients in the South Florida area, but we're also privileged to serve patients from almost every continent on earth. And so when you have patients coming from Asia, Europe, Africa, the Middle East, their care has to be coordinated and their preoperative workup cannot be compromised because we have to have the same level of diligence that we do for any local patients. And so we leverage telehealth frequently, but having a partner that can manage a lot of these services, that can manage the lab work and the other tests that need to be done so that they can be delivered to a physician's office before the patient even arrives, before they even step foot through the practice doors, I think that's very powerful.
Yeah, I mean, that's one of the things that we're able to do, right? A lot of our patients come because they don't have primary care providers, they don't have access to primary care providers, they're not able to communicate with the primary care provider they have. We're able to do everything from, obviously obtaining a very thorough, complete history, but also ordering pertinent labs, EKGs, chest x-rays, anything that might be needed to do some kind of risk stratification before surgery.
Right, absolutely. And it's, it's a safety issue, right? But it's also a logistical issue because, my practice, any surgical practice really, if you have a last minute cancellation because of additional lab work being necessary or an additional consultation being necessary, an additional imaging study being necessary, that case is canceled. And it's usually very difficult to replace that case with another surgical patient that's ready to go for surgery. So from a logistical standpoint, I think it's very important as well.
Yeah, and from the patient perspective, right? You took that day off of work, you were planning to be,
absolutely,
like all the planning that goes into, if you have young kids, you have to, make sure that somebody's being able to care for them because you're going to be recovering from surgery, and suddenly that just all gets scrambled.
It's a lot of logistical issues, and that's a great point.